An 18-year-old female presents to the GP with red, hot and painful spots on her face. As usual, start by asking about the onset, duration, intensity, progression, and aggravating and relieving factors. Because we're dealing with skin here, we can actually take a more flexible approach. Ask where else on the body the spots are located, any other abnormal colours, any discharge or swelling, and any itch along with the pain. And you can do a quick review of systems to check for any systemic symptoms. All these clinical details are important, but remember to take a step back and ask the patient if this is all affecting her confidence and if it's having a big impact on her life in general. This is not only a great way to build rapport, but also ensures that you're treating the patient as a whole. Ask about past medical history, medications, especially contraceptive pills, family history, and social history. The key differential to keep in mind is polycystic ovarian syndrome. Ask the patient if she's ever been diagnosed with cysts in the ovaries, if she's noticed any recent weight gain, or any excessive facial hair growth. Stress and depression could be very relevant in this scenario, so ask about general well-being and mood. Take the vitals and examine the skin from top to bottom, not just the face. Before moving on to treatment options, you should first ask the patient what her understanding of acne is. You need to explain that it's not actually due to poor hygiene, but rather a chronic inflammation of the skin. We're about to cover this on the next slide, but a general rule is that GPs can only prescribe topical treatments, whereas specialists can prescribe oral treatments. Give advice to wash the affected areas with warm soap and water twice daily, not to excessively scrub the skin, to avoid picking the spots, and to avoid wearing makeup. Advise to use an emollient if the skin gets dry, and to switch to a combined oral contraceptive pill if she's on a POP. The medical management ladder is as follows. First line, topical benzyl peroxide, which are your over-the-counter treatments. Topical retinoids, topical antibiotics, oral antibiotics, and then finally, oral retinoids. Before prescribing any retinoids, it's really important to do a risk-benefit analysis and to counsel the patient on possible side effects like teratogenicity. Offer information leaflets, a follow-up, and encourage to seek further help if red flags come up, like fever, joint pain, and resistance to topical treatments, so that she can be referred to a dermatologist.